Hello everyone, this is Dr. Priya here and welcome to Neuroots Hair Clinic. In our last videos, we have talked many times regarding DHT blocker, its mechanism of action and side effects. Today we'll talk about if finasteride side effects are reversible, or how long does it take to reverse the side effect of finasteride, or if you're using a topical finasteride, are there any side effects with that? So let's discuss these topics one by one. Most common asked or faced questions by physician or trichologist while treating a patient with hair fall or androgenic alopecia is that the possible sexual side effect that comes with finasteride. Well, there are so many misinformations which is given or you can see in the net, in the media, or sometimes by physician also, that it gets confusing for the people out there to use finasteride. Well, finasteride is one of the most popular and effective medications for men looking to prevent hair fall in case of androgenic alopecia or male pattern baldness as we call it, which accounts for more than 70 to 80% of the population. But having said that, if anybody is taking finasteride, one should understand what to expect when they're taking this medicine. So let's talk about few common and uncommon side effects that comes with finasteride. But before we move on to talking about common and uncommon side effects, please remember that the side effects that comes with finasteride are generally very low and it does not necessarily happens with everyone. So the first common side effect is erectile dysfunction. Well, in a clinical trial, approximately 1.3% of men who took finasteride experienced this as compared to 0.7% of people who has taken non-therapeutic placebo. Second common side effect is decreased libido. And the third most common side effect is ejaculation disorder. In total, 1.2% of men who are using finasteride reported this issue of ejaculation disorder. And 0.8% of men also reported of reduced volume of semen as compared to 0.3% of men who used only placebo treatment. The side effects that I just mentioned are common with those patients who are taking higher dose of finasteride like 5 mg, which is mostly used in treating BPH, which is benign prostatic hypertrophy, and not androgenic alopecia. Now let's talk about some uncommon side effects which can vary from depression, pain in testicles, blood in the semen, but all these side effects are extremely rare. The conclusion of this part was finasteride or a DHT blocker is the best possible medicines to treat androgenic alopecia, and if its effects are very much proven. There are several studies that have shown that a long-term administration of finasteride is safe, and 1 mg of finasteride is a very low dose and side effects with this much dose is very unlikely. But even if somebody is experiencing any side effects and if you've decided to stop it so that you don't experience the side effects again, all these changes are very much reversible. Like I mentioned, finasteride is one of the most effective treatment when it comes to androgenic alopecia, and there are very few alternatives to this medicine. So it is very important that the patient takes this medicine regularly, and if they experience any side effects, they should contact their doctor. Most importantly, the intake of this medicine is voluntary, as male pattern baldness is a cosmetic condition and it is entirely up to you if you want to continue this medicine or not. At the end, I would like to talk about few of the contraindications, as in there are certain conditions where you should not continue the DHT blocker or finasteride. These are, first one is oligospermia. Oligospermia is a condition where your sperm count is below the normal level. Second is if you have any history of infertility. Third point is if you are newly married or if you are trying to raise a family. I hope this whole video was informative for you. I'll see you again with a new video. Till then, please take care.